done different types of trainings in Liberia, and also some work with tuberculosis in Nepal. And then I was working here in Austin as an acupuncturist. I love TCM. I love herbs and just being nerdy with those as well. And when the pandemic came, it just felt that there was no way I could not go back to my public health roots and help. I don't know how many of you guys have worked in public health or are interested in it, but they were just scrambling to find people with an epidemiology background or different things of that nature. So when the pandemic hit, I just felt the call, and I went ahead and applied to a couple of different positions to see if I could jump back in. And I got a couple positions right in the beginning of the pandemic. I went to West Texas and I did epidemiological disease investigation. So that was in around the Lubbock and Amarillo area. And I don't know if you guys recall, but at that time, the meatpacking plants and many of those types of farm work were really having tremendous and very heartbreaking outbreaks. So I went and did a contract for the state of Texas with the Department of State Health Services and did epi disease investigation. And I'm going to talk a little bit about that later as I get into more of the COVID stuff. And then now I currently run a testing site I'm a safety officer for Austin Public Health. And we have a big drive-through testing site here in Austin. And today I had to call Donna because I was on site and there was construction going on outside of the site and they broke a gas line. So here we are on our testing site doing our job, trying to bring through, 500 cars today. And we had to evacuate the site and evacuate the staff. So I called her. I wasn't sure I was going to get home in time to do the seminar. So I hope that you guys bear with me if I seem a little bit tired. It's not because I'm not excited. It's just because it's been a very long day with that. But everything ended well. There was no explosion or anything like that. And the Austin Fire Department is awesome and they fixed everything. So let's go ahead and skip over. Get started with this. So some of the webinar goals that I have are just to discuss the ways to protect our clinics, ourselves, and our patients from SARS-CoV-2. We'll talk a little bit about public health precautions and protocols. And I'll try to put in personal information to make it a little bit more interesting for you guys. I know safety isn't always the most sexy topic in TCM, but it is really important. And when Donna first contacted me about doing a webinar, I thought, well, maybe it's a little bit late in the process. And that some people, Dr. Chen had done so much great information about herbs and treating COVID. But as Donna and I talked, we decided, well, it's good for people to kind of brush up on some things and maybe just kind of check and see if what you're doing in your clinics are working for you. And if you guys have great things, I really want you to share them. If Donna wants to read off what people have to share, that would be great as well. With the clinic safety protocols, everybody has different things that their state requires. So I'm not really going to go into very super specific things on that. You really want to check, obviously, with the CDC, with your state organizations or your state website. I pulled from a couple different organizations, the NCCAOM for their infection control advisory, and the ASA, the American Society of Acupuncturists, looked at some of their information. But again, your state is going to kind of trump everything. So you want to go ahead and follow their evaluations. So just a little funny, I did another seminar for eLotus before about safety with infectious diseases and talked a lot about hepatitis and HIV and MRSA, things of that nature. So some of this from the universal precautions is going to be from that webinar, the same slides. And then we'll kind of see like, oh, this is what we were worried about with bloodborne pathogens, but wow, we really have to up our game for a respiratory pathogen. So I just always like this little funny when I'm talking about infectious disease, because it is terrifying for the patients to come through the testing site, and then we're in full PPE looking at them, you know, with glasses and goggles or, you know, shields, and it just looks like an alien trying to get a nose swab on them. My best friend is a ICU nurse in Colorado, and right now one of the most heartbreaking things for him is to be in the room with a COVID-19 patient who is passing for, you know, an hour and a half, and you know, you can't touch them. You're double gloved, or you have on a Tyvek suit, and so that touch that we love as acupuncturists is really important. We all know when people are at the end too. So this is a really tragic pandemic that we're experiencing. So standard universal precautions, again, this is kind of our pre-COVID where we were, what we use for the bloodborne pathogens with hepatitis, you know, C, and with HIV. Obviously, we want to think about it with any kind of bloodborne disease. This is the boring part. So if you stay with me, I promise we'll get to the good stuff and a couple stories. So universal precautions, obviously, we want to treat every patient that they are all thought to have a bloodborne pathogen, and thus they're capable of infecting us as healthcare workers. So this is crazy, upping the ante for COVID-19. We want to really look at our patients as they are carrying asymptomatic disease if they're not having symptoms, and the viral load can be high and spread very quickly with asymptomatic disease. So universal precautions are important, but just your respiratory precautions are just beyond reproach right now. So this really just emphasizes that we want to treat all the patients that to protect our workers, ourselves, our families. So you look at the standard precautions, we all know this, hand washing, but how many of us actually washed our hands before COVID, actually washed our hands, you know, 20, 25 seconds and singing the songs and getting all of the parts of our hands. You can do a test with gloves, and then you can use ink or paint, and you'll see all the areas of your hands that you can miss when you're washing your hands. So we'll look at a little slide about proper hand washing technique, but I'm absolutely sure we all know that now. I hope we do. Personal protective equipment, PPE, is such a 2020 buzzword right now. There was a difference in what I would consider PPE for dealing with acupuncture pre-COVID, and now what we're dealing with post-COVID. One thing that we're really conscious of in public health is making sure that we're keeping the most protective equipment for healthcare workers that are at the most risk. So those ICU nurses and docs, and those ER nurses and docs, especially doctors who are doing the intubation, it's just critical that they have the correct protection. I'm terrified with this current surge of what will happen if we have another PPE shortage, which possibly could be coming. So that's something we want to keep in mind as well. I'm going to kind of go through a bit. Again, everybody has their different way of doing it. Every state has different ways. Every organization has different suggestions. So I think we're all finding what we are seeing. Hey, Donna, is there something in Q&A that you want to read to me, or should I go in and check it? Donna, you there? Okay, so Diane's asking, are the KN95 masks protective enough for dealing with a COVID patient? I'm actually going to get to that. So we'll get to that when we cover the PPE part. But it's a good question. It really depends on the quality of the mask. So a good friend of mine lives in China, and he has been working with procuring PPE. He's married to a Chinese TCM practitioner. So I'm going to cover some tidbits that he told me about the quality, and we'll cover other types of masks as well. So disinfection and clean environment, we've got a slide on that. Sharps disposal, we're not going to really go into that here on this webinar. It's just part of our standard precautions, so I leave it on the slide. Respiratory hygiene, we will definitely cover that, and cough etiquette. And then aseptic non-touch technique, I don't really have a slide on that, but I find it to be really really interesting. If you guys haven't looked at ANTT, like their website in different areas, it can give you some really interesting information about preventing infections in healthcare settings. So it's really about hand hygiene, and then a clean environment, a clean sterile field, and hand hygiene. So again, for us, it would be, you know, the hand hygiene. If you still use cotton, I know the CNT has done away with that, but if you use cotton and alcohol, you do that, and then do your procedure, and then your hand hygiene, and then clean your work, you know, come back, hand hygiene again, take out your needles, clean, you know, hand hygiene again, clean your work area, and do the hand hygiene. I know for a fact that there were acupuncturists before COVID that didn't practice great hand hygiene. Unfortunately, I've seen that even in community clinics. So I'm actually really glad that everybody's really focused on this hand hygiene. And then waste management, I'm going to go through a couple of the suggestions from the NCCAOM about linens and laundry. You guys can find all of that information on your own, or we can go through questions as well. So I tried not to get too boring on it. For hand washing, you know, always, this was pre-COVID, always before and after a patient. You know, if you're wearing gloves, if you were doing bleeding or something, you want to definitely wash after that, and after touching contagious objects. So obviously we have to up our hand hygiene in the times of the Rona. So we really want to wash our hands every chance that we can get. Sanitize and wash our hands every single chance. So the proper technique, you know, obviously using water and soap and rubbing vigorously for 15 to 20 seconds, 20 to 25 seconds. You want to wash, the next slide will have like a little picture, but you want to wash between your fingers, nails. If some people are still wearing jewelry, I really encourage you to find a way to get that really clean. I wash my hands 1,000 times a day, so I don't wear any kind of jewelry or anything anymore. Even when I worked in a community clinic, I didn't. It just kind of got in the way. Rinse and dry with a clean towel. Don't use the same towel all the time. I know we are conscious as acupuncturists, and we all want to be environmentally as sound as we can, but unfortunately right now there's just a lot of disposable sanitary products. A good rule is to sing your ABC song or sing happy birthday once or twice through, or you know, write your own song about hand washing. Maybe if we have a little time at the end, I could sing you guys this song that I wrote to part of Ice Ice Baby by Vanilla Ice, and it's like mask baby, you know, and then it'll be like Corona, but it's kind of a public health song, and I wrote it on the testing site with the staff just one day to like laugh and kind of lift our spirits as well. So write your own song about COVID or hand hygiene. So the proper technique is, you know, palm to palm, your palm over the dorsum and the palm over the right dorsum of the hand, palm to palm with your fingers interlaced, backs of the fingers and opposing palms. So this one is actually a part that if you do kind of put on gloves and see with the ink test, you'll see we miss a lot of this part. A lot of people, you know, just kind of did the regular easy hand washing in the past. The rotational rubbing you can do to kind of clean specific areas. I really don't do that as often, but I do a lot of in between the laces and together. I wash up the arms when I'm washing as well. Now, it depends on what kind of PPE you're wearing to how you want to sanitize your hands and forearms as well. So previous to SARS-CoV-2, our little friend, we wore gloves when we were dealing with blood and bodily fluids. So if we were bleeding or doing bleeding cupping, wet cupping, or even sometimes with regular cupping, people wore gloves. I know as acupuncturists, touch is so, so important to us. So gloves are a hard sell right now. And so a lot of places recommend, if you're comfortable with them, wear them. If you're not, don't. Just really practice your hand hygiene. Eye wear and goggles if you're bleeding. So if you're doing any bleeding techniques, you know, we've all tried to protect ourselves in the past. Some people more than others, probably a personal preference back then. Now it's a lot more important to wear goggles, a good pair of goggles, or a shield when you're in the room with patients for a significant amount of time. In the past, I talked in that other webinar about MRSA, so I talked about covering wounds with gauze. We won't get into that today, but if you are interested in infectious disease, I think it's on their website that you can go and watch it for free or something. It was a couple of years ago when I did that. If there's cuts on our hands, we want to use some kind of resistant occlusive dressing or gloves if you're comfortable with them. Again, that's with bloodborne products, but it's also very important with anything that we have that's contagious right now. Interesting that we have wear a nose or mouth mask if applicable. You know, my mother, she had a respiratory disease before she passed away. And if, you know, she got sick, a cold, the flu, you know, anything, even if I thought I had allergies, I always wore a mask to be around her. So, you know, a lot of our colleagues are from Asia and they're very interested in wearing masks. When I was in Nepal, we wore masks when there was in a closed quarters in a monastery sometimes, or we wore masks even for pollution. So it's very common, as we all know, in Asia. So what would you consider, this is a question, a significant amount of time in terms of being face-to-face with a patient? 15 minutes or 30 minutes. Right now, the CDC, it was 15 minutes previous, but it was 15 minutes continuous. Now they've changed for SARS-CoV-2, for COVID-19. If you are in the same room with somebody for 15 minutes over a 24-hour period of time. So if you're inside with somebody and you're not outside, 15 minutes is definitely a significant period of time. Obviously, you're wearing PPE and your patient is wearing a mask as well, but I would definitely err on the 15 minutes. Some of you might think I'm really nuts and crazy if you're watching this and you're not really a follower of germ theory. I come from a public health background, and this presentation is based on public health science. So I know there'll be some people that may disagree with you know how. Oh, you're welcome. It may be a difference with how people disagree on that, but you really, really, really want to try to follow the science on this. I know people are being very careful. All right. So PPE to use during the pandemic. I just kind of made this slide to go over a couple things. So somebody asked about masks before. So it needs to be a 3-ply mask. If it's a cloth mask, you need to have a filter in it. I personally would not wear a cloth mask with my patients. I'm not seeing as many patients now because I'm working tremendous hours at the testing site. But when I do see patients, a lot of times I'll see them outside. I do wear a good quality KN95 for patients, and I do wear a face shield. So if you have a surgical mask, the surgical mask will have that droplet barrier, so it's just better than a thin cloth mask. Neck gaiters and those really thin masks just are not protective for you or the other person. There was a study a couple weeks ago about neck gaiters, so you might want to look that up if you're interested. N95s, if you have access to them and you're not taking from are, frontline hospital staff that's in dire need of them, or you had some that you were using in the past, you can go ahead and use those, especially if you have a patient who is considered very high risk. So I do have a patient that has a genetic disorder, which causes her to, the person to have cyclical vomiting syndrome, and it's really rough. It's a younger patient, and I do wear like high quality PPE when I see her, and I also see her outside, so that and I spend very little time. There's not much talking. There's just putting in the needles and working on that. We decided to continue with the treatments because the chances of her going in the hospital are very high when she gets the cyclical vomiting, and she will not do well if she goes in the hospital. She has a lot of precautions because of those comorbidities. So again, if you are wearing like a KN95, so there's a gentleman that's an acupuncturist from Canada, but he lives in China with his wife, who is Chinese. And they went around and found some excellent quality masks. They tested the masks and they did the water test. So if you put the mask, the KN95, and you put some water in it, it should hold that water. That means it's a fairly good quality from what my friend discussed with me. If you're put it on, you want it to fit tight. Some of them are smaller, some of them are bigger. Everyone has a different size face. But if it fits and you can see it kind of moving while you're breathing, that's also good to do. After the break, I'll get you guys I'll get one of the ones that I use and show you. It's a Honeywell made brand, so it's a very good one. If you're using N95s or KN95s and you want to try to preserve them, the way that I've been taught to do that is to put them in a brown paper bag. So what you would want to do is have a brown paper bag for Monday, Tuesday, Wednesday, Thursday, Friday, and you're going to wear your Monday mask. And how you take it off, actually, I've got a video in here that describes that, and I can demonstrate if we have time at the end. But how you take off your N95, you don't want to touch it and pull things from your face. You want to touch the straps. And then if you put it right into the brown paper bag and let it sit for a week and don't wear it again till the next Monday, that even some hospitals are doing that. So that could be an option if somebody had 5 of them, or if you're only seeing patients 3 days a week or something of that nature. Again, I would suggest using at least a surgical mask. But if you do have a very, high quality, different types of fabric, they're saying maybe have one that has multiple types of fabric with the 3-ply, and have cotton and polyester and use a filter, those types of things. Face shields and goggles. So PPE during our COVID is important, I believe, to wear a face shield or goggles. They have some of, those old school chemistry goggles. I think those are usually very good. They're much easier to get now than they were in the beginning of the pandemic. So that's a good thing for us. A lot of the face shields that everybody are using are the ones that we've all bought online with the thin plastic, and they have the film that you peel off. So those are useful. Let's check our questions. So the person is asking, Diane, if goggles are needed over eyeglasses. So I personally, if I'm seeing a patient, I'm using a face shield, and I have these are my little readers. They have little rhinestones, so they have a little bling for the pandemic. But I will put my glasses on and then wear my face shield over it. If I am at the testing site and I am using goggles, yes, I wear my glasses and then I put the goggles closely fitted over them. I did see a really cool little tip one time about the surgical masks. When you put them down and you bend them over your nose, a doctor that I know had shared, he put a Band-Aid over the top of the surgical mask and it held it down and it didn't fog up his glasses. So I thought that was pretty cool. With an N95, how long can one be with the patient? How long can one KN95 be used? Okay, so that's a really good question, and I'm not sure that I have all the answers on that. With an N95, Yeah, you could be in the room with the patient a little bit longer, but if you don't really need to be, don't be. So if you're screening them as they're sitting outside in their car, or you're doing an intake online, or doing an intake over the phone, or, you know, email or online intake form, I would still suggest that. I still would be in the room with the patient as little of time as you can. And N95 does provide much more protection, and if it's a good quality one. So I think that you could be in a bit longer, but I wouldn't push it. I wouldn't do our marathon, you know, just chatting with our patients and enjoying all that time with them. I know we all miss that. I miss it tremendously as well, but I still would err on the side of caution personally. With the KN95, ideally surgical masks and KN95s and even N95s before the pandemic were meant to be disposed of after a patient. Obviously, we can't do that right now. We don't have enough PPE. So if you're seeing a patient, you have a very busy clinic, and you're going room to room to room to room, yeah, I'd probably change it. You said halfway through the day. I would probably do that. It really depends on your comfort. The patient should be wearing a mask as well, so that offers another barrier. So in the beginning, oh, don't wear a mask because we don't know if it's protective in America. Of course, we all knew from Asia that, yes, they're very protective. Then they said, okay, yes, you wear a mask to protect the others. Now they have done some very good studies recently to show that you wearing a mask also protects yourself. So an N95 or a KN95 obviously provides more protection for you. But if you're wearing a surgical mask and a face shield, if you feel comfortable with that, or if you're wearing a KN95 and a face shield, then you can wear that KN95 for a longer amount of time. With your face shields, I would suggest a lot of times I'll use like a little alcohol pad that we used to use to wipe the skin. I'll use that and wipe mine down. Everybody has different sanitizing solutions, things that they're using. So if you're wearing the face shield and you have your mask on underneath it, you can even put a surgical mask or a cloth mask over your KN95, and then you can change those out. So those will make your good masks last longer. Yes, exactly. Diane said she sees nurses wearing a surgical mask over their N95. We do that. A lot of people do that in the hospitals for their patients. I know people in the ERs and ICUs, but at the testing site, we will wear them if we're not in the hot zone. And I'm going to talk a little bit about the testing site just because I think it's interesting, and I want to talk to you guys about the different types of tests. So yes, wearing a surgical mask over it can protect it, and you can get more wear out of it. And so with gowns or scrubs, I know like in all the acupuncture Facebook groups, it was all really kind of a to scrub or not to scrub, and what people were doing before the pandemic and now currently during the pandemic. I do wear scrubs because I like them and they're comfortable. It's like I'm wearing scrubs right now for my presentation, but I think that they're comfortable. So it's like wearing pajamas to me. So I enjoy wearing them. I wore them before the pandemic. If you don't want to wear scrubs or you want to wear gowns, then you want to change your gowns. I personally don't wear a gown unless I'm in the hot zone testing someone or in a case where I'm with a very high risk patient. So, you know, as long as we're not spending a significant amount of time in the room, we're not intubating people. If patients are coughing or you have a patient that has COPD or something like that, even with a mask, yeah, I probably would wear a gown for that. So you have to use your best judgment on that. And see what your comfort level is. Again, with the lab coats, everybody's excited about wearing lab coats and it's winter. So, you know, make sure that you're washing your scrubs and your lab coats. At the end, I'm going to tell you what I do when I come home from work and how I try to protect myself. I don't have kids or a husband or partner or anybody to worry about. I just have a little dog laying next to me right now. But I do still try to take protective measures when I come home from work. So I'll go over that later. Is one scrub enough when you see more than one patient? Yeah, one pair. So I totally got what you meant. Yes, I mean, again, unless you're seeing patients that you can confirm have a much higher risk, then you might want to change. There was so much information in the beginning about this, about do I come out and change clothes between every patient, or do I, change clothes? People are not doing that in the hospitals. I mean, number one, they don't have time. If they're working on a COVID unit, then they're seeing, COVID 24 hours a day on their site, on their shift, then obviously they're going to stay in the same clothes. If they're not on a COVID unit, like an ICU nurse that's going back and forth, they are not changing they're changing their gowns. They're not changing their scrubs. And then they actually, for a lot of times for ICU patients that are not COVID confirmed, some of them are just wearing surgical masks. So, we can go really crazy with the protection. Hand hygiene and not touching your face goes a really long way. Wearing a good mask and eye protection goes a really long way. The studies that we saw for how long the virus can last on surfaces or clothing, when they first came out with them, we didn't know. I mean, no one knew this is a novel virus. We didn't know anything about it. So there were a lot of studies. I will tell you that from a studies standpoint, when you're looking at those types of things, it is done in like impeccable environment. So a prime environment for that virus or that particle to survive. So when you're looking at those types of things, remember that like the viruses and things, they can break down in different environments, a UV environment or things like that. If you're sanitizing properly and, taking care, I don't think it's necessary to be changing clothes constantly 24/7. If, unfortunately, someone sneezes on you or coughs, then I might have a spare set or, proceed to use gowns or something else you have. But washing your scrubs a lot and washing your lab coats is really important. I know sometimes, people used to wear lab coats in student clinic and then they never wash them. And so that's not something that we want to do nowadays. Nancy's asking, do I cover my hair? I always wear my hair up whenever I'm seeing patients because it's long and I don't want it to bother them or tickle them. When I'm seeing a patient in clinic, or now if I'm seeing people outside or things like that, even when I worked in the community clinic, I always wore my hair up. Especially it was like scary if I was doing cupping or something. But now if I'm at the testing site, I wear it up like in a knot on the top of my head and just away from my face. And then if I am in the hot zone, I do wear a little cap, a little nursing cap. I don't know how much that makes of a difference, to be honest, but I think it looks cool anyway. So gowns, what is your suggestion with disposable bio aprons as more plastic is coming into use? I am really, really stressed about how much waste we are putting out into the environment, but for a novel pandemic virus, I don't think there's anything else we can do. So with gowns, I would say find ones that you think meet your standards and safety standards. Some people will use like, a cloth gown just in case, as that added protector, and then they change those and wash those. But if you're using disposable gowns, I know that's hard for us because we don't want to put all that bio waste out into the world. But I think unfortunately right now it's necessary. So there are all types of different gowns. At testing sites, people a lot of times are wearing Tyvek or they're wearing a gown. I'm here in Texas, so at our testing site, it can get really hot. When we had our first surge and peak in July, it was unbearably hot outside. And so we had a gown for the hot zone swabbers and collectors that was not quite as plasticky. and more canvassy because it was so hot, and the plastic ones can get hot. Now that it's getting cooler, we had 2 really cold days here, and all the testers really freaked out. So we were using like more of the plastic gowns, and I agree, I hate using them, but unfortunately in the testing situation where they're exposed to a viral load, they have to. So you guys can, use your judgment, do your research. Afterwards, I'll give you my email address. I, by no means, can make a recommendation to you. I'm not a lawyer. I'm not anybody who's licensed to be able to tell you what to do in your clinic. You really need to connect with somebody at your local public health department for guidelines on running your business, or somebody who is a lawyer that's working in these kinds of conditions. Your local acupuncture associations. I know people are always talking about Door Out in California, or they're talking about the American Society of Acupuncturists. There's a lot of great information out there. It can be overwhelming, so just bite it off a little bit at a time. But unfortunately, I'm not really able to give like a personal recommendation because I don't have that kind of degree or licensing. yes that we're getting a comment that yes, this is a pandemic. It's a mess. I mean, every day I can tell you, compared to what I see now, compared to what I saw a month ago, there's much more sick patients coming through. In the summer when we were at our peak, there were patients coming through that literally, I was swabbing one, literally threw up when I was swabbing her because she was so sick. So it's a dangerous time. Do anything you can to protect yourself and protect your patients. So gloves, we talked a little bit about that. I'm not gonna carry on about gloves because I know in our acupuncture family that some people think wearing gloves are great. Some think people wearing gloves are horrible. So I don't really wanna have a big old debate on a webinar, but I do think if you are concerned about things with your own personal hands and you are okay needling with gloves, then you can do that. If you are performing in previous to Corona, I would have told you to wear gloves for bleeding techniques and things of that nature. So use your judgment on that. The one thing is, if you're going to the grocery store and you're wearing gloves, don't then get in your car and touch your cell phone and do all that stuff with the same pair of gloves. You're just moving all that stuff all over. And then when you take off the gloves and you touch your phone, then you touch your face and you're gonna just get virus. So I do believe that sanitizing your objects is a really good habit to get into. I mean, cell phones are filthy anyway, but if you're sanitizing things, and I don't even wear gloves to the grocery store now personally. In the very beginning, I did because we didn't know that much about it. So I wore a glove to hold my basket and touch things with. And then I, safely and cleanly took off the glove and tossed it. And I hated it because it was plastic for the environment. So with the sanitizers, there's a lot of great information online. It's way too much for me to get into all the different types of sanitizers. I will share a little bit about cleaning clinics and stuff towards the second part of this. But with sanitizers, just be careful and look at some of those lists that they have online for ones that might have contained dangerous ingredients and things of that nature. The CDC does have that EPA approved sanitizer. I know it's very difficult to get sanitizers. And so there's just a lot of natural ones that we used to like to use that aren't available. So do your research on that. So I just put Baby Yoda in here because he's so cute, and how can you not love Baby Yoda? And right now I have to look at Baby Yoda memes when I come home from work because it makes me happy. So I saw this one and I didn't even know how to give credit or permission for using it. It was on the Baby Yoda memes. So forgive me on that, but it goes over your nose. We all see these people going in the store. They got it over here on their chin. It's not a chin strap. It's not a head bandana. Our nose needs to be inside the mask. So I love this, and you can find it online and you can print it and put it on your door for your patients or whatever. But I mean, who doesn't love Baby Yoda? correct, wearing a mask is really, really important. So I am going to show you guys a little video. So it's a donning and doffing for PPE that is more for a hospital wear, but it's good information about taking off gloves, and it just helps us think about how we're taking off our masks. So I'm gonna have, how are we on time? Okay, we're doing okay on time. So I'm gonna go ahead and share this little video, and then I will come back.
How to safely take off personal protective equipment, more commonly called PPE. We will demonstrate one way to appropriately take off or doff PPE. More than one doffing method may be acceptable to your facility. It's important that you receive training, demonstrate competency in removing your PPE without contaminating yourself, and practice your healthcare facility's doffing procedure. Remove and discard your gloves. Gloves can be removed using more than one technique. For the glove and glove technique, pinch the outside of the glove near the wrist. Peel downwards, pulling the glove inside out. With your ungloved hand, slide your finger under the wrist of your remaining glove. Again, peel downwards, turning the glove inside out. Discard the gloves. For the beaking method, pinch the outside of the glove near the wrist. Using your finger, pull the glove inside out and over the fingers and thumb to form a beak. With the beaked hand, pinch the opposite glove at the wrist and pull downwards, turning the glove inside out. With the ungloved hand, pull the beaked glove off, touching only the inside of the glove. Next, remove your gown. Untie all ties or unsnap all snaps. Some gown ties can be broken rather than untied. In that instance, break the ties gently, avoiding a forceful movement. Reach up to the shoulders and carefully pull or roll the gown down and away from the body. Dispose of the used gown. You may now exit the patient's room. Perform hand hygiene by using alcohol-based hand sanitizer or washing your hands with soap and water for at least 20 seconds. Be sure to clean your wrists where the edge of the glove was located. Carefully remove the face shield or goggles by grabbing the strap and pulling upwards and away from your head. Do not touch the front of the face shield or goggles. Next, remove and discard the respirator or face mask. If you are wearing a respirator, remove the bottom strap by grabbing only the strap and bringing it carefully over your head. Grasp the top strap and bring it carefully over your head, and then pull the respirator away from your face without touching the front of the respirator. If you are wearing a face mask, carefully untie the straps or unhook them from your ears and pull the mask away from your face without touching the front of the mask. Lastly, once again perform hand hygiene after removing the respirator or face mask. You have now completed the doffing procedure.
Okay, so let me go in and share our PowerPoint again. Is it back on the screen now, Donna or Sam?
Yes, it is.
Okay, thanks guys. I'm sorry. It's been a long day. I've been at work since 6. I know that's not an excuse and I don't want to waste anyone's time. So please forgive me, everybody. So in that little video, it just shows a little bit about how to take off your masks, which I think is good information. Again, we'll cover some of this as we go through, but covering our cough, we all know how to do this. Cover your nose and mouth with a tissue, cough into your arm or sleeves. Obviously, coughs are really, really important now. If you're coughing, I've seen people actually take their mask off to sneeze or cough. Don't do that. If you sneeze in your mask, change it and clean it off. Someone asked about sharing or reusing face shields. So Again, I would take like one of those little alcohol swabs and just kind of wipe it down and sanitize it if you can. There are different sanitizing solutions that you can buy online for face shields. So look into that as well. With this was a slide from one of my other presentations about clean needle techniques. So just things to remember, you know, our disposable needles, treat within our scope, get additional training if you need it, review our clean needle technique. And, you know, if you don't feel comfortable treating some patients, then go ahead and refer them out. One thing about working with infectious diseases, you have to think about infectious, contagious bodily fluids. So OSHA has standards for this that obviously don't apply to all of us as TCM practitioners. You know, blood does. Hopefully you're not dealing with semen, vaginal secretions, cerebral spinal fluid, synovial fluids, amniotic fluid, other body fluids. You know, we do deal with body fluids. People do have secretions. And what we're seeing now, according to OSHA, it wouldn't be considered a contaminated secretion, but you know, they are now. COVID changes a lot of things. So nasal secretions, we don't want to touch someone's nasal secretion and touch ourselves. With sputum, that's something that we use collections for TB. So, you know, that can be highly contagious in a respiratory disease. So even though they consider it not a bloodborne fluid, sweat and tears, urine or vomit, saliva, all of those are now have a different meaning to me. So if someone opens up their car door on the testing site and vomits into the parking lot, as a safety officer, I have to go decontaminate that. Like that's not a good fluid to have in general, but definitely not now. Feces is controversial because it never makes these lists, and it kind of annoys me because it can be really contaminated with bacteria and other things. According to OSHA, it's not the most infectious, but I still think it's highly suspect. There are studies in different places in the United States and overseas that are doing virus testing on fecal matter and testing like dormitories to see, and then if that comes back as showing in the fecal matter, then they're testing all the individual students in the dorm or things like that. I think that's really interesting. I don't know how much of a viral load it carries. I haven't had time to dig into it as much as I'd like, but you can look that up if you're interested. Here's our little friend, the SARS-CoV-2, the Rona, as I like to call him. So with coronavirus, we know the symptoms. 2 to 14 days after exposure, obviously we have asymptomatic carriers. Ourselves could be asymptomatic carriers. But if we are showing symptoms, you know, the fever and chills, the cough, the shortness of breath, the fever is this big screening tool that everyone wants to use. But I mean, 1/3 of patients actually probably spike a fever. And a lot of times, excuse me, if it's a patient, they're taking acetaminophen or other things for the body aches. And so they're suppressing the fever anyway. If we're treating ourselves and we have a mild case of coronavirus and we're treating ourselves and we're taking herbs, then we could suppress our own fever. So it has to be looking at the pattern of symptoms that we all are familiar with. Fatigue and body ache are huge. A lot of patients will complain of that. The loss of smell and taste, that's our go-to with corona right now. A lot of people are seeing that. It's that new loss of smell or taste. Sore throat, congestion, other things that could be allergies. But it's good if people have these symptoms. Right now, if you have free testing, get people to get tested. The GI symptoms, where you can have the nausea, the vomiting, the diarrhea, there is new research showing that if people are showing significant GI symptoms in the beginning, that they may lend towards a more severe case of COVID-19. So it's something to be aware of. Emergency signs that people are having trouble breathing, a pain or pressure in the chest, confusion, inability to stay awake, not able to kind of see, being really confused. And then obviously anything is blue. If lips are blue, gums are blue, nail beds are blue, that's a major emergency. So they need to to go ahead and move on to the ER and the ICU nurses at that point. Little is known about emerging diseases in general before they appear. We're always like, oh, here's one. SARS-CoV-2 is a novel virus. We've never seen it before, but it does follow similarities with other outbreaks. So we all know how quickly this became a pandemic and spread, and how scary it was back in March and April, and other countries, what we were seeing in January and February. So the evolution of the pathogen that's been previously animal restricted can cause that virus to emerge, and then it's capable of attacking or using a human receptor to enter a cell or different cellular machinery to cause infections. So that's what's happening with these zoonotic diseases that jump. So with the SARS outbreak, I know we're tight on time, so I don't want to go too much into it. But, in 2002, 37 countries were affected. It was around 8,000 people, 10% of a case fatality rate. So it was a severe little critter that we had. It jumped from bats and then to a civet cat, and it was pretty severe. And our Asian counterparts really learned a lot about the virus very quickly and did a great job of trying to help patients with it. MERS, the Middle Eastern version, kind of jumps from a bat to a camel. It came in, I think, 2012, and it affected about 1,700 people with a case fatality rate. So it was 35% case fatality rate. So it was more deadly. So coronaviruses are named coronaviruses because of the crown. So they're an enveloped RNA virus. They're a positive strand RNA virus, and they fall into three different categories: the alpha, beta, delta, and gamma. The alpha and beta are the ones that infect humans. It's the largest RNA genome known overall. I still believe that. I think that is still true. And it traditionally causes respiratory illness. We're seeing that, and it's a bit terrifying what it can do to your lungs and cause long lasting. The one thing I'm so worried about with COVID is just what we're going to see coming out of it long term with the long hauler disease, but just with comorbidities that are going to affect the lungs and the heart and the kidneys. So there's a lot to think about it when people go, oh, I'm young and I'll survive it. They don't know if their heart's going to be damaged. So we'll just look at the structure. This isn't a virology seminar or anything, but, I just think it's an interesting little guide to look at. I sometimes can go deep into the depths of this book. This was my favorite class in MPH school. I learned from Dr. Daniel Bausch. He's one of the leading hemorrhagic fever virologists in the world. So I get kind of nerdy on this, so I'm going to pass over that structure. So if we go on and look at disease theory of infectious disease, so the germ theory of disease is currently accepted as scientific theory for many diseases, and it just states that microorganisms or pathogens or germs are going to lead disease in the body. The small organisms can be too small to see, and they invade humans or other animals or other living hosts. When we look at infectious disease, it's caused by the entrance into the body by the bacteria or the protozoans or the viruses or the fungi, and they're going to grow and multiply. So a lot of people will use infectious disease with contagious disease or communicable disease. The infectious disease, the ID doctors that are out there working on this are my heroes, and they are just amazing. If you're looking to follow some really intelligent, really awesome ID doctors, public health guys, Dr. Peter Hotez, he's at the Baylor School of Medicine. He's fantastic. Dr. Daniel Bausch, he's one of my favorite professors, and he's now at the London School of Public Health. He was at Tulane. And then Dr. Osterholm up there in Minnesota, Michael Osterholm, he's now will be on the coronavirus task force, and he is an infectious disease genius. I just adore him.
Ready? Okay, ready,
Yep.
yes.
Okay, I'm ready. Can you guys hear me and everything, I think? All right, so I looked at the chat. If you guys have questions, the Q&A is easier for me to see the way this is set up, but I looked at the chat and there were a couple questions. Let me just touch on those. The mask, someone had said about their face was longer and that their chin sticks out, their nose slides out. So the Band-Aid trick for your nose is really good. Just put a Band-Aid over the top of it when you bend it, and it kind of holds. The chin part, I think you just have to try a couple different. I mean, a lot of surgical masks are long, and some of those KN95s are long. So I would look and see at what different types you could use. Someone asked about cell phones and sanitizing surfaces. So we did touch on that a bit, that surfaces need like a real specific environment for it to last. But yeah, I do sanitize my cell phone. I will just use an alcohol wipe, or I'll use a witch hazel wipe or something like that. I spray the sanitizer we use at the testing site on a paper towel, and then I wipe my phone down. And then I saw that people were talking about going room to room. Yes, I didn't mean to suggest that you go room to room without sanitizing and making yourself sanitized as well. Obviously, take your time, and more time between patients is definitely needed. So I agree with that, chat. And then someone asked about saliva tests. So I'm going to cover some information at the end about testing. So let's go ahead and move through so I don't run out of time and I can get you guys the good stuff. So Public Health 101, masks right now for COVID-19. We all know it. We've talked about it. Social distancing, 6 feet. I will tell you, when you're outside and it's cold, I mean, inside droplets are shared very quickly, but when you're outside and it's cold, the droplets can go longer and they hang in the air a bit. So I make now the employees that are working at my testing site, if they're sitting and eating lunch or something like that, unfortunately, make them sit at their own table so that they're not taking off their mask and eating. And so they're not sitting there kind of chit-chatting with their friends without a mask. They probably all hate me, but that's okay. Keeping them safe is my priority. Hand hygiene, we've already talked about that, but I cannot stress it enough. With COVID, it's the number one thing. Your hands clean and don't touch your face all over. Cough etiquette, we talked about that. Don't take your mask off to cough. That's terrible. Testing, I've got slides on that, and we're going to cover it. And then ventilation and HEPA filters. Unfortunately, I just don't have time to go into that. I'm not an expert at all on filtering and ventilation. So there are a lot of information that you can find on that. So I encourage you to do that. With public health, this is the Swiss cheese model. You'll see all different kinds of versions of it. But with coronavirus, we want to enact all of our public health measures. So the masking, the distancing, the washing our hands, the testing, the contact tracing, all of the things, the tools we have in our public health shed, we want to enact them, because if the virus gets through one level, like the Swiss cheese has a hole, hopefully it hits a solid part in the next level and doesn't get through. So all the layers are really, really important, and they work together to stop and keep us safe. So you can see the little coronavirus over here, and he's getting through some levels, and then you see the happy little family with their face masks on. So hopefully we're going to see less and less and less transmission if we're practicing all of the layers. That public health is really important. There's all this talk about the vaccine, but right now what we have are our public health measures to protect ourselves. I am going to talk about testing. I know people are interested in that. Again, it's going to be my opinion based on what science that they have out right now. But rapid testing definitely has some challenges that I'll talk about. So I've got a lot of disinfection information in this. You can go back and look at it. I want to get to the more exciting stuff to talk to you guys about. So I'll kind of run through this really quick. It's from the NCCAOM recommendation, their little clinic infection control advisory. They had one come out early and then they updated it. So you want to look at a lot of their tools. They have some great stuff online. I have the EPA pesticide registration, their disinfection list against the SARS-CoV-2. It's hard to find some of them. I know that, but you want to find something, unfortunately, that's probably a little bit stronger than what you'd used in the past. A hospital graded disinfectant is what I recommend. It's what I use in clinics. It's what I use at the testing site. Wipe down, clean everything. I know you guys are doing that. So 1 in 3 adults are using chemicals or disinfectants unsafely because they're panicked about COVID-19. So don't mix your chemicals together. When you're cleaning your toilet and it's always like, don't mix this with any other cleaning solution. Don't do that. So if you are sanitizing a lot in your clinic, which I know you guys are, be safe and wear some protective gear to protect yourself from the fumes and things like that. Always read your instructions, but don't mix things. Using bleach to disinfect, to be effective, this is always something I teach with like MRSA. It needs to be mixed with water, and it's a 10% solution is generally best, but different products have different dilutions. So you want to follow the instructions. Again, this is just some information for, in general, how to disinfect. So I don't want to waste too much time going over it because I believe you guys are all seeing patients right now and you should know how to disinfect. But there are things that you want to look for. Even now, they'll be listing SARS-CoV-2. There's ones that list that they're protective from MRSA. Obviously, focus on disinfecting your high touch surfaces and where, protecting yourself and cleaning up after yourself and hand hygiene. Common areas to disinfect, the sinks, countertops, refrigerator handles. A lot of this is for your home, your bathroom sinks. I want us to protect ourselves too. So faucets, bathtubs, showers. If you live in a house with a roommate or something, you can have some spray in there to spray down your sinks and your door handles and your toilet switches and all of that. Light switches, people forget those often. Don't forget those. Everybody touches them. Obviously, in your clinic of equipment, most of us, I'm sure, have taken out any inanimate objects in our clinic that we don't need, but sometimes people used to have toys and play tables. So in pre-COVID times, you want to keep those equally clean. Any kind of remote controls that you have, your phones, etc. So social distancing, this is a term that we've all grown to talk about now. People never knew this was part of it. It's been a part of like tuberculosis for a long time. They've used different terminology for it. Physical distancing hopefully is maybe a little bit easier to say. Social distancing makes us seem so isolated, but you can call it whatever you want. Just stay away from people. Stagger your patient appointments. I know you guys are all doing that. I saw in the chat people sharing information. Please do that. Have your patients wait in the car, screen them by the phone, screen them by Zoom, talk to them on Microsoft Teams, however you want to do it, is a good practice, and have them come in one at a time. We don't want them sitting around in the waiting room together. Go directly to your treatment rooms. I know everyone's doing that. Mark your floors if you had to for 6 distance rule, but hopefully we're keeping people really far apart and taking them to the room and out without passing others. Streamline your checkout services, your electronic methods. That's less for you to have time face-to-face with them and less time for you to have to touch things and then have them touch things. The plexiglass, I know we're all using it at the grocery store, and some clinics are using it, community clinics, and some clinics are using it to protect their patients. Schools are using it. I'm not sure, honestly, from my personal opinion, how much protection that gives us, but it's an extra layer. So it doesn't mean you can use plexiglass and not wear masks and shields and protect yourself in that way. So it's just an added layer. It's not going to hurt to use it. It's more plastic in the environment, unfortunately. But again, we have to get through this pandemic. We're getting to a really hard time in the surge and the pandemic. So we just have to really up our skills and go back to where we were kind of in March and trying March and April. So patient screening, most people are doing it. Have your patient have appointment required. Determine your screening and when to refer that patient to the MD. I think this is really important in the COVID-19 pandemic, is that we really need to decide when we need to refer somebody. The disease can progress very quickly. And even in the ER or ICU, a patient can be doing okay for COVID and take a very quick turn. So if you see any of those emergency signs, obviously they have got to get to an emergency room quickly. All staff and patients screened. So the thermometer screening, yes, we're doing it. It provides a little bit of safety. It provides a little bit of screening, but it's not your end all be all. Not everybody is going to show a fever. So be careful not to overuse that. I know some people are using pulse oximeters to kind of see what people's oxygen saturation is. That can be useful. It's very useful if a patient's recovering from COVID to monitor themselves as well. So you kind of choose what screening, asking them to, sign something that they don't have a cough, that they don't have a fever, that they're not exhibiting, multiple symptoms is good policy to protect yourself as well. Provide sanitizers and masks if you can. Sometimes we have that patient that is forgetful. And so, if you want to have some surgical mask available for them, some people sell them, some give them, whatever you feel like you need to do. And then screening for symptoms and temperature we talked about. Excuse me. So laundry considerations is wearing gloves when handling laundry. I think that's a really good practice. It's a good practice to do even before COVID. Washing your hands before and after. Wash your hands constantly. Store your clean laundry away from treatment rooms. I know a lot of us had beautiful clinics and we used to have our little pockets or our little cabinets. We had our laundry and our linens in, or towels or whatever you use. And that was good, but I would suggest storing it away from treatment rooms right now. Using hot water and laundry detergent. There are laundry sanitizing detergents, and I know Lysol makes a product. People buy those up, by the barrels full. But it might not be, if you have a really busy clinic, it might be a good idea to do that. Drying them on high, if that's a possibility also. So just, using hot water to kill things. And soap. Waste management. So with this was a lot of what I used when I teach other safety seminars and on bloodborne pathogens. So it's a lot of repetitive solutions with the bleach and dispose of the linens. You really got to up your game with COVID, and I know you all have. And I'll just take a minute to tell you guys how proud I am of everybody who's out there really finding a new way to practice in this pandemic. Or if you're not able to practice right now and you're protecting yourself or a beloved family member, I'm proud of you too. I mean, we all have to do what we can to get through this. And I tell the staff at the testing site how proud I am of them for being a part of history. So we all have a role to play where we are in that right now. A little bit before we get into the interventions and the testing is, people ask me a lot about community clinics, and I love community clinics, and I used to work in one here in Austin, and I love it. I love the patients. I love the theory behind it. Make sure that you're really made structural changes and that your chairs are extremely far apart. Maybe you're only having 1 or 2 people in your big room that used to fit 15. Cleanliness is really a top priority. I don't treat people face down if you're using side rooms with tables or whatever. I know there's a lot of discrepancy about that, and we don't, have to debate that. From my personal opinion, there's just a lot of things that come out of your face when you are face down. And if you can find a way to do that really safely and protect everything, your floor, if you don't have carpet, and if you're protecting your cradle with plastic and things like that, there are ways you can do it. But I personally choose not to do it right now, if at all possible. I know sometimes we have to, but take extra precautions. And then with community clinics, filters are really important. I know people have done a ton of research. You can find a lot of that in those acupuncture groups online as well. Really enforcing a mask policy, a shield policy, really making sure that our patients are washing their hands. I made patients do that before COVID. I'd say like, oh, can you wash your hands? And then I'll take you into the room. So I know a lot of people maybe didn't focus on that, but they are now. So, screening patients, health screening is really important. We can think about things to do for community acupuncture going forward, I think, and see if we can come up with some creative solutions for that, because a lot of community clinics are still closed down. And we need them. They provide a valuable resource, in my opinion. So with the public health interventions, let's check my time, testing, and then, epi disease investigation. I'm going to talk about what I did out in Lubbock, because I think people find that interesting. Contact tracing. And, I should have put down here isolation and quarantining as well. So with the testing, I have 2 slides on that, so we'll get to that next. But for the epi disease investigation, that's from an epidemiology view. We want to look at it and see, collect that data. Man, as epis, we love data. We want to collect the data. We want to find patterns in the data. We want to make charts with the data. We love data. So when I was out at the beginning of the pandemic, I started looking for public health jobs, and I found one with the Department of State Health Services for Texas out in West Texas, in Lubbock. And that area is the part of the United States that 1/3 of all of the beef in the entire country of the United States comes from. So it tells you how many farms and ranches and slaughterhouses, meat packing plants, all of those things are out there. When I got to Lubbock, it was devastating. It was just horrific what was happening in the meat packing plants. I was really sad. I was glad to be there, trying to help in any way I can. And I did disease investigations. So that's the person who calls and talks to you after you get a positive test. Many of these patients did not even know they had a positive test, and I might be the first person they talked to after they got tested to find out they had a positive test. So it could be heartbreaking. People were terrified. We didn't know anything about the disease or how to treat it at that time. It was a difficult job. And what I did was I would call and go and talk to them and see how they're feeling. If they didn't know their test results, talk to them about what that meant. They may not understand what a positive test even meant. And then gather data from them, demographic data for usage, but also data about their symptoms. And to me, that was a really important part, because I went through all of the symptoms, and then they would say, oh, I don't have any symptoms. And then, I get to headache or diarrhea. Oh yeah, I had 3 days of diarrhea. Or, oh yeah, I did feel nauseous. Or, I had the worst headache I've ever had. They weren't associating them with the outbreak of COVID. And so we were collecting really valuable data at that time, but also trying to provide the patient with information about when to go to the hospital and stuff. It was really kind of a scary time for people. And so it was heartbreaking, but I was glad to be a part of it and try to help. A lot of people in the meat packing plants are refugees from other countries. They don't have a lot of options for other jobs. They didn't have a lot of information. I used the translator line nonstop for African languages. Burmese was a lot of Burmese speaking patients, Thai languages, Thai. And obviously, you know, more common languages that we might see with some French-speaking countries or Spanish. So I did utilize the translator line quite often, and that was so useful. The translators were fantastic, and they could help me get a lot of valuable information. With clusters, you're looking for groups of where there's an outbreak, and it was interesting. I did find a cluster, and I called the head epidemiologist and told her. I called one guy, and the girl that was a disease investigator, we were actually doing this in a room with each other, which was odd, but it had to be done that way at the time. And, you know, we were protected, but it was still a bit odd at that time in April. And she had gotten a patient on the phone that was living in this hotel. And I kind of overheard her conversation. And then I called another patient that was positive, and he was talking about a hotel. And I was like, what room are you in? Well, we compared room numbers. I called the next patient on my list, and they were in the same hotel. It turns out a cornfield agriculture group put these migrant workers in a hotel. They were just, it was just like a mini cluster of COVID-19 at this hotel. And it hadn't been found, that cluster. So I called the head epi and I alerted her to it. And then they were able to send somebody out there and test everybody in the hotel. So, you know, it provides amazing information to disease investigators. So if someone calls you, it's really good to communicate with them. The contact tracing that happened after they spoke with me. So what would happen is I would call and say, okay, how many people are in your household, whether their ages, whether their names, whether their phone numbers, because we're going to follow up with them and, you know, check and see how they're feeling. And it's really vital information when we're trying to stop a pandemic. And I know people don't want to share their personal information, but they share everything on this. Every little app that you have is sharing all of your data. So, you know, if you're having patients resistant to contact tracing, or even you yourself are resistant, I really encourage you to participate. It's a major part of public health. And if we would have used it in the beginning and we would have investigated the disease, identified the clusters and traced and isolated, we would not be where we are. Right now on, what day is it? I forget, November 18th. We would not be in this situation. Many countries are not in the throes of the very deadly surge that we're seeing. I got a question. Let me check on that. A question I may have: to treat patients for eye conditions, so needling around the eyes, scalp, etc. I'm going to defer to you on your own needs with that. But again, I probably would not be doing a lot of facial acupuncture where you're in the room with the patient for 45 minutes or an hour. If you need to get to points that are around their eyes and you can't use a distal point, and you're touching some bodily fluids, I would probably wear gloves for that patient. I don't know if you guys have seen, there are some facial acupuncturists that have different seminars, and some of them have adaptive masks, and they've got plastic plexiglass they put over. So you might want to investigate some of that if those type of facial activities are your specialty. They are not my specialty, so I'm not gonna go into too much of that. So anyway, I think it's really important to respond and participate in these type of public health interventions. Testing considerations. So the PCR nasal swab is the gold standard. So at the testing site I use, it's a 10-second swab. Yeah, it sucks a little bit. I tell patients I'm about to tickle your brain, so just hang tight. I give them a little story or talk to them about the beach or whatever to distract them. It, you know, we'll go in and you'll go back, and then you go into the pharyngeal cavity. So it can be a little intense, but most people do really, really well with it. The PCR is the gold standard. I can't stress that enough. If my loved ones needed to get the test, that's what I would want them to get. The test 3 to 5 days after exposure to a positive case. I think this is important to us if someone calls us and says, oh, hey, I'm positive. Well, if you saw them yesterday and you get tested today, you're not going to show a high viral load to show up on a test. So isolate yourself, quarantine yourself, and then test in that 3 to 5 day period window. Some people may have a differing opinion on that. Most public health experts that you follow will give that window. Most people in the testing world will give that window. Everybody is different. Of course, somebody could acquire a really higher viral load if they're exposed to a really high viral load. So if they're intubating patients or they work on the COVID ward, when they didn't have proper PPE, especially, or, you know, they're surrounded by, look what happened at Mardi Gras. So Mardi Gras, you know, we didn't know about COVID as much then. We saw maybe what was happening overseas, but it wasn't that big of a deal. New Orleans had a horrific outbreak because people were exposed to super high viral loads. There were just thousands of people everywhere, probably lots of carriers. I had several friends that were in healthcare and have passed in New Orleans in April. So, you know, it can be devastating. Higher viral loads, I personally believe, are one of the causes that, you know, so many healthcare providers are getting infected. Again, we didn't have proper PPE or didn't know very much. I mean, most people in a hospital weren't wearing PPE. They weren't treating measles patients, or they weren't, you know, treating too much outside of a tuberculosis ward. So we've learned a lot. And unfortunately, some highly, highly trained doctors and nurses and other personnel have passed. So we must isolate after our test results. So until we get our test results. So after our tests. So people will call me, friends of mine, oh, I need to get tested. And then they're like, oh, I'm going to, you know, go over here to the grocery store. I'm like, no, don't do that. If you go and get a test, you need to isolate yourself and stay home and not spread anything. If you're getting tested because you want to see your grandma, don't go and get tested and then be like, oh, I'm gonna go to work and do all these things. Now I'm gonna go see grandma in 5 days. Don't do that, because you're giving yourself a false sense of security with that, and you're going to be lax around grandma, and we don't want to do that. Or grandpa, or a child, or anyone. I'm not trying to be ageist with the grandma. I was just using that as an example. So due to false positive, or a false positive, or a false positive can be possible. I don't even know why I put that in there. It's really a false negative. I think I messed up there. So due to a false negative, it's best to isolate 10 to 14 days. There is a study out of Germany that shows 10 days from the onset of symptoms, the patients aren't contagious. It's a very good study. It has good data. We're going to see a million more studies, and there are more about that. 10 to 14 days is the gold standard. I think the CDC still says probably 14 days. So it's best to isolate. If you got a negative result, but you have symptoms and you know something is wrong, you probably got a false negative. So don't go out and share it with your friends and family. I mean, even if it's influenza, don't go out and share it with your friends and family. So isolation is really key to public health right now with stopping the spread. Rapid tests, I'm going to talk a little bit about that. They're not really reliable unless used on a daily basis. So I think a rapid test could be a great tool in a school. The rapid saliva test, where, you know, the kids can do the saliva test. If they were testing people, or in a workplace, 3 times or 4 times a week, and they would catch that viral load when it started to rise. Again, you can spread when you're asymptomatic, so I know it's not fail-proof. None of this is fail-proof, but they do have a place. But I still look at it and think about the White House outbreaks. You know, if the rapid test they were using there is the Abbott, it was one of the first ones developed. It was all we had in the beginning, but they're better rapid tests now, and they continued to use it, and they were just getting probably an extreme amount of false negatives. They've had outbreaks all over, you know, Washington, D.C. So I think it's not the most reliable. I hope there are some more reliable tests coming along. Everybody's working on them, so I hope there are. So we talked a little bit about the PCR tests. This is a diagnostic. This is a viral test, a molecular test. It's the nasal swab, the NP, where I'm going to come and tickle your brain to check and see if you have COVID. Some places you go, they'll do both nostrils. Some places you go, they just do one. At our drive-up testing site, we have the patient face forward, tilt the head back a little bit. That way, if the patient does sneeze, they're not sneezing right at the tester. So if they're doing both nostrils and it's not a walk-up, there's a lot of different ways of doing the testing. So they do wear like the mask over their mouth just in case they cough or sneeze. It's probably not going to make that much of a difference, but gives a little added barrier. Our swabbers, we have one person go in and they do the nasal swab, and then they take the nasal swab, break it, and the collector has the tube. So that person is there to monitor and make sure everything's safe, and to check IDs, make sure that we don't give anybody the wrong information. So it's we try to make it as safe as possible. This molecular test, the PCR, shows if you have an active infection. So 3 to 5 days is when most people are going to get their results back. Just last week, one of our labs was running it 2 days. It was great. We could get that test back in 48 hours. People were getting their results. It was great. As the surge, Texas, we're in a very difficult and horrible space right now. We are on an exponential curve. And so testing sites will probably see more delays as labs get overwhelmed, but I've hoped that the labs have learned something since July, and I hope we can keep up with the volume of testing. Again, the molecular, the NP swab, is our most accurate test. I'll jump down to antigen testing next, because this is when it's diagnostic also. It's usually a nasal swab. They may not go as deep as an NP swab. They may do like an antigen, like a saliva swab in the mouth. These are diagnostic. They're faster. They're more rapid. They do test for an active infection. They have a higher sense of false negatives, and so they are less accurate. The curative test is one that is one of the mouth swabs that's just come out and is being used. I'm trying to follow the data on that, but I'm really busy with our current surge. But if you're interested in the mouth saliva swab, that's one of them that I would suggest looking at. It shows that they have a sensitivity equal to an NP swab. Again, I haven't delved into the data, so I'm not 100% sure. There are these saliva, the spit tests that they're using. A lot of the meatpacking plants are using them now. Schools may be using them. Again, it's a tool. If we were using them on a regular basis, I think it would give us a lot more information than just getting a spit saliva test once a month. The last one is the antibody test. Let me check our time. All right, we're good on time. So with the antibody test, this is a serological test. This is a blood test. You're going to use a finger prick or a blood draw. It can give you a result for the antibody to see if you've had a past infection in 15 minutes or 1 to 3 days, depending. You may need to get 2. I've seen a lot of research suggesting that people get 2 antibody tests to see if they're getting an accurate reading on that. There's different things that they test, and immunology is extremely complicated, and there's not time to get into it on a 3-day webinar, never mind a 2-hour one. But you want to look at the IgG in the nutshell. It's like your short term, and IgM, which is your long term antibodies. Most places are testing the IgM. A lot of companies will go into a workplace and test like using an IgG, and that might show if somebody has an active infection. Now they're probably doing a lot of antigen testing to see if in workplaces and things like that. But again, with those rapid tests, I personally believe it's a series of them that's going to help you catch it. If they become really cheap, if you look at what the NBA did with their Saliva Direct test, it's called Saliva Direct. Look it up. It's amazing. Now they did go in a bubble, so they were really protective in that way. But they did use this really good test that I think it was Yale School of Public Health collaborated with them on and made it like open sourced. People can go in. I don't know why we're not seeing the Saliva Direct tests out being used in the market. Maybe they are, and I just haven't come across it. But it has they compared it to the PCR test sensitivity, and then they used the saliva direct to make a comparison, and it was pretty comparable. So some of them are like $5, I've heard. I haven't come across them. Someone's asking about, can there be false positive tests? 2 people tell me they tested positive, but they didn't have any signs or symptoms and tested negative days later. So in my professional opinion, yeah, there could be a false positive, but it's rare. There were some antibody tests, back in probably April or March or May, or probably in May, that came out, or June, that somewhere I read one of those antibody tests had a 12% false positive. That is really high to me. So they've come, they're better now, but they're still not great. So yes, you can have a false positive, but a false negative is much more likely. And if people are asymptomatic, they can still spread the virus. So if they get a false negative, especially if they have symptoms, they need to isolate. Right now, with the way the exponential curves are going and the surge is really doubling now so quickly, I think it's good for most people to isolate if they can, if there's any possible way. We're healthcare providers, we're using PPE, we're practicing hopefully very good sanitation techniques. So, I know our businesses are, in my opinion, necessary. But, a lot of people, if they can stay home right now, they should. I believe that. And our patients that are really nervous about COVID-19, get them to use curbside pickup and have things delivered if they can, because with community spread, I just talked to my staff about, our staff at the site. They're not my staff. I don't own them, but the people who work at the site, I was just talking to them about community spread today. What we were experiencing maybe a month ago or 6 weeks ago in the grocery store or at the gym or wherever we were going, I wasn't, but if you were, or other people were, or friends were, is way different than what we're experiencing now. Now, the community spread is so far out there. I mean, people are just walking around with the COVID everywhere. So people aren't wearing masks. It's a different situation. So now is a really good time to up your precautions and take care of yourself. So someone in the Q&A is saying, locally, our county nursing home had several false positives, but the control test was found to be inaccurate. All tested negative a couple days later, and we're all asymptomatic. That's great. I'm glad to hear that. I don't want anybody to have this disease. So I do think that testing has been a major failure. In my opinion, in the United States, we did not even control. I mean, they just gave emergency use to all these tests, and Kimmy McMinn could have made a test and went out there and said it was accurate. I'm really disappointed with how testing is rolled out, and I hope that we have made some strides in the last few months, and I hope we continue to make much more accurate tests and that people can believe in the test. I think that there's so much confusion. Okay, so any comments on accepting patients back into practice who tested positive? I'm going to table that for a second, so bring it up again towards the end. I have some thoughts on that, but again, I can't legally give you advice on that. So during April and May, when I was out at the meatpacking plant that I talked to you guys about, the facilities were just highly infected with SARS-CoV-2. I mean, most of the infected workers were of ethnic or racial minority. A lot of them were refugees. They couldn't even understand the information that was on the television. It's not translated into Burmese for them. It's not translated into their Sudanese language. And so the meat and poultry processing facilities tried to come out with some information about how they could protect their workers. I just thought this was interesting to look at, that were they actually providing culturally appropriate health education materials? Screening, that's hit or miss. Encouraging hand use and face coverings, increase in the worker space. In these plants, these people are arm to arm next to each other, elbow to elbow, and they are screaming at the person in front of them because it is loud. It's freezing cold or it's hot and it's really loud. There are droplets flying everywhere. People are screaming. It is a really, really risky environment and a very dangerous job before COVID-19. So when I saw this come out, it didn't come out for a long time after the meat packing plants were all blowing up. And I got put on a special group for contacting the only meat packing plant workers and getting their information. And I had a separate survey from the CDC about were they getting information in their culturally appropriate language or their cultural appropriate education materials. And that's huge in public health, making sure we can get to people with the information they need. So, some would say they were maybe by the end of May, but in the beginning they weren't. And that was a huge failure. I have my own thoughts about the businesses. They didn't want people out sick. They wanted production to keep going. And it was very sad. People were going to work when they were sick. It was a very sad time to be helping. I tried to do anything I could to help people. So this was interesting information that they put this out. I'm hoping that they're following this more now. I probably wouldn't, bet on it that they are. Maybe some plants are doing better. Stuart said, I thought IgG is long-term and IgM is shorter term and IgA is intermediate. So unless I'm really having a brain fart, I was taught IgG is the shorter term. So you can research that on your own or check me. I'm sorry if I shared some misinformation. I usually am pretty strict about my public health information, so I hope I didn't make a mistake with that. So the next slide is personal safety. So I know we only have a few minutes left, and I really appreciate you guys' time. To support ourselves, we're acupuncturists, Chinese medicine practitioners, herbalists, functional medicine. We know how to support our immune system and take care of ourselves and our family. We continue to do that. Wash your hands constantly. Don't touch your face. Like, it's amazing. I counted one time back in March or April how many times I touched my face in like within a 2-hour period, and it was insane. So really, I really like face shields when I'm busy doing something because you're not touching your face. The cloth masks, a lot of times people are touching them, or the other masks. Just don't. Slap your hand and teach yourself not to do that. Charge yourself $1, whatever you want to do. Avoiding contact with sick or exposed contacts, that's really hard to do. I mean, we don't know who is walking around asymptomatically. So, if we know someone's really sick or our best friend needs help and we want to go drop off groceries for them, just do it non-contactless if you can. When they're in the long hauler syndrome and people are treating them after that, they're out of the infectious period, that's a different story. I'm not really talking about that. Stay home if you're sick. Everybody's like powered through being sick. If we've learned one thing in the United States, it's like we need sick time. We need time to stay home. We shouldn't be going to work when we have the flu. We shouldn't be going to work when we have something that we could spread to someone else. They may not have the immune system that we have or have access to herbs. So I think it's really taught people stay home if they're sick. Think of other people. My mom had breathing issue, and before she passed, I think I mentioned in the beginning of this, we used to wear masks if we had anything, even if it was allergies. We weren't sure. We didn't want to give her a cold. It would have been deadly to her. Patients that we're seeing with those different types of environments, I'm sure many of you have worn masks in your clinic to not expose somebody, even if you just had a runny nose that day. So flu shots, I'm not going to have a debate online about flu shots. What I want to say right now is that in public health, a flu shot is a useful tool. Yes, it's not always 100%. Yes, some people may have a reaction. I know that. But right now, to avoid overrunning our hospitals and not making our frontline ER and ICU docs and nurses and even the cleaners in the hospitals, I think it's a really important tool that we have in our shed. I know people have a lot of aversion to this, and I said I'm coming from a very strong public health background, so I'm just going to leave that there with your little asterisks. and we'll move on. So I just had a little slide about influenza. You know, there's millions of cases a year. It spreads easily, droplets and sneezing and coughing and loud talking and yelling, shouting at games and all of that. We've all spread the flu, and now that flu could be deadly, and it could also use up valuable medical resources that patients need. So it's usually, you know, self-limiting and you get better. Complications can include, you know, pneumonia, ear infections, you know, problems with heart disease and asthma, diabetes. Obviously, that's important to prevent the spread. Wash your hands, covering your mouth, masking, disinfecting all your clinic spaces. I think that's really important. That's why I kind of threw that in there. I sometimes do a little bit about influenza. It's you know, right now, I just think it's important to protect people. We don't want to overrun the hospitals. Let me see, there's a question, and then I'm going to end on a little bit of mental health. So are you deferring dental checkups or other non-emergency medical services throughout this time? Great question. Myself, I actually probably need to go for my dental checkup, and I haven't gone. I also don't want to expose my dentist. I love her and she's a fabulous woman. And so for me right now, I personally am. I think that dentists are practicing, the ones that I know, my college roommate's a dentist, and he's practicing extreme public health measures. So they're being very, very safe. If there's an emergency or someone needs dental work, I don't think people should put it off and get worse and have an abscess go to their brain or anything like that. For medical procedures, most hospitals are starting to shut those elective surgeries down now. I mean, elective surgery could be like having your gallbladder out or other things that we don't think of as elective. It's not, you know, plastic surgery for your frown line you don't like. So I do think we are going to see patients deferring care for cancer, and that's very dangerous, but they're terrified to go in the hospitals with these surges that we're seeing in the Midwest and what we're seeing in Texas and, you know, all over 49 countries having huge surges. So some worse than others. Each hospital is making that decision. So I wouldn't be the person to encourage any patients to do or do not do that. I would have them talk to that medical professional and have them decide with their oncologist or their dentist whether that's appropriate for them. So I wouldn't put myself in that. But from my personal standpoint, I probably would defer something that I didn't think was emergent. But, you know, I did probably TMI, but I did go to my gynecologist during this time. They're taking great measures. She's been my doctor for many, many years. So, you know, there are things we don't want, you know, cancer screenings or things to get missed either. So it's a fine line, but a lot of hospitals you're going to see are be shutting that down. Protecting ourselves, you know, when I come home from work, I spray my shoes down. I work at a COVID testing site. It just makes sense, you know. I spray them down. Lots of my friends give me and gift me some disinfectant sprays, and I'm very thankful to those people. I live in a small complex, so I don't leave all my stuff outside. I don't have a garage to change out of. If I did, I probably would take off all my clothes and throw them in the washer outside. But when I come home, I like go right to my little laundry room and I take off my clothes and throw them in the washing machine. And then I go straight to the shower and take a shower. And I always tell my friends, they want to talk to me. If I get home, I'm like, hold on, I got to go wash off. You know, I just have to. I have very long hair, so I do wash it often, more often than I probably used to. But if I'm not in the hot zone actually doing tests and I'm just on the site overseeing things, and we have the site set up by various PPE, and we are an outside drive-through site, so I don't always wash my hair when I get home. Again, I live by myself. If I had a loved one I lived with, or if my parents were still alive, I probably would be a little bit over the top. Make sure you're cleaning under your fingernails and things like that when you're cleaning. Just try to get in the nooks and crannies. It's good practice in general. I know we're almost out of time. So caring for your mental health, this is for you guys. Taking breaks to relax and doing activities that you enjoy, taking care of your body with exercise and diet. I am not doing that right now. I am so guilty of it. I have been eating like a COVID queen. And I don't eat well if I'm at the testing site for 8 or 10 hours and they bring in lunch. I just eat whatever it is. I need to do better on that. And that's one of my goals when I get through the surge, to try to get myself back into taking better care of myself personally. Knowing the facts and understanding the risks, getting the information and helping our patients understand the risks can make the outbreak less stressful. We are going, in my opinion, I'm not trying to scare people, but in my opinion, we're going to see things that we have not seen in this country in our lifetimes, probably, unless you're well on in years. So I really think that we have to prepare ourselves mentally for what is coming. People in New York, I'm from New York originally. My cousins live in New York. Saw a very different thing. In New Orleans, I've lost several friends in public health and that work in the hospitals, and overseas. I mean, we lost one of the best tuberculosis doctors that Africa had in the beginning of April. So, it's stressful. So staying connected with people and trying not to be too isolated, finding a trusted support system, Zoom is great. Asking for help if we need help. And that's my last slide is mental health support resources. So you can go in and jot these down, or things that you want to share with yourself or your patients or your family or your friends. This disaster distress hotline, people can use that after hurricanes and things. I've never called it myself, so I don't know how great it is, but it's a starting point. Suicide prevention line, we all know that. That's very important. Crisis text line, you can text to this number and they'll text you back. The Trevor Project is for our LGBT colleagues and for our patients. It's a special project that they can get some support for special situations that they may be facing that some of us don't have to face. I mean, so much discrimination right now during this pandemic. It's very sad, and we are losing a lot of our colleagues that are Black and brown, and that's really sad. The health disparities, this shows that the health disparities are, and racism is a public health issue, in my opinion. Domestic violence, people being locked inside a house with someone who is hurting them. Oh, how stressful. I can't even imagine. And then the SAMHSA hotline, that's for, I missed an H in there, I'm sorry. That's for, it's a government hotline. And really you can kind of call and they give you like referrals to other services probably. And then there's a COVID-19 mental health support hotline. I haven't called it. It's off the HHS, the Health and Human Services website. I don't know what they have to offer, but I think at least having something to offer people to try to have some of the online resources or phony resources, it's better than nothing. Obviously, it's not what we need and what we prefer. I think our mental health and the PTSD our healthcare providers in the hospitals are experiencing is extreme. And a lot of us as well, if we've lost family members or friends, or we're scared about getting it if we're at risk. So we have a lot of concerns in our little ACU family. So I know it's hard. And again, I just really respect you guys and keep on fighting the good fight. Are there any last questions? I know it's time to wrap up, and I know that was a long-winded presentation. So I hope you guys got something out of it. Again, I am no means saying I'm the end-all be-all expert of any of this. These are just some information that I had. Donna approached me about would I be interested in doing this, because I've done other safety and infectious disease trainings for ELOTUS, and I love ELOTUS. I love Donna. I love Sam. I love all you guys. And I've learned a lot through Evergreen with their herbs. Fantastic. So I'm glad to be a part of it and to participate. So I really thank you guys, and I just wish everybody lots of safety and lots of health, and hopefully lots of prosperity, and take care of yourselves. I'll quit talking now, Donna. You probably have to say goodbye, but thank you guys so much, and be safe out there, please.
Thank you, Kimmy, for a great webinar today. And thank you guys for joining us as well. Today's webinar has been recorded, so if you'd like to watch it again, you can log into your eLotus account and find it on our TCM Wisdom Tube tomorrow afternoon. That's it for today, everyone. Thank you so much again, and have a great rest of your week. Bye.